Half a century. That's how long it takes for a man to develop an enlarged prostate. And half of all men over age 60 will develop this condition, also known as benign prostatic hyperplasia, or BPH, a non-cancerous enlargement of the prostate, restricting urine flow. By the time men reach their 70s or 80s, 80% will experience urinary symptoms. You're about to meet some of those men who are losing personal freedom and compromising their lifestyle. Men who, like millions, experienced a variety of painful, annoying, and embarrassing urinary symptoms, suffering with an enlarged prostate gland.
At night, I was up to go to the lavatory about every 2 hours or less. I could almost set my watch by it. During the day, it was about every 1 hour.
The problem I was having was the little bit of pressure. There was still urine in the bladder, and I just couldn't relax.
It was a very uncomfortable kind of a situation. It limited my mobility because of the infection. I had some swelling, and in some cases, if I let it go a little bit too long, it was even difficult to walk.
There are many common symptoms, among them frequent urination, especially at night, a sudden need to urinate, a weak stream, or pain or burning during urination.
One thing that would always irritate me is that I would go out to lunch with somebody and the guys would be in and out of the bathroom in around 30 seconds, and after 2 minutes I'm still forcing my urine and nothing's happening.
The prostate is a walnut-sized gland that forms part of the male reproductive system. It surrounds the urethra, the canal through which urine passes out of the body. With age and time, the prostate enlarges around the urethra, causing pressure similar to a clamp on a garden hose. The result, urinary symptoms and difficulties.
It was kind of embarrassing because you had to, go to the bathroom a lot, and you can't tell people what's going on, and you just suffer through it, that's all.
Relax. Freedom to live your life is here. A simple, safe, and effective solution unlike any other you've ever heard of before. Introducing a revolutionary breakthrough that's becoming the new gold standard of care for treatment of an enlarged prostate. It's called greenlight PV laser system for photoselective vaporization of the prostate, or PVP for short.
And there's no burning, there was no pain. It was amazingly seamless and amazingly easy.
Previous to the laser, I heard about the what they used to call in layman's terms the old rotor thing, and I was happy I didn't have to go through that. This one is virtually painless, so it's much better.
Other treatments require the patient to compromise safety or outcomes. You might have heard the stories. Prior to greenlight PVP, patients experienced prolonged hospital stays, greater risks of complications, including excessive blood loss, incontinence, and impotence with invasive surgery. Other lasers and heat treatments resulted in delayed urinary relief and compromised urine flow.
When he had the procedure, he had to have a blood transfusion. Then he had to put a catheter in him for, I don't know, it was 5 or better days. And after that, he had to wear Depends until he could control himself.
So how does it work? Greenlight PVP uses a patented high-powered green light laser to immediately vaporize and precisely remove enlarged prostate tissue. A thin, flexible fiber is inserted into the urethra through a cystoscope, an instrument that allows the doctor to examine the bladder and urethra. The fiber transmits green laser energy that quickly vaporizes and precisely removes the enlarged prostate tissue. Via the cystoscope, the physician is able to safely view and control the treatment area, tailoring it to each patient's anatomy and needs. Doug and Debbie Harris chose greenlight PVP for treatment of Doug's BPH.
Biggest thing is sleep at night, because every hour and a half, 2 hours you're getting up. You're not getting a full 8 hours sleep.
Did you take medication?
Well, he tried the medication,
Okay.
but really after a couple months we could see that wasn't going to work. So we had consultation. We set this up to have this procedure done because the medication really wasn't doing anything.
With greenlight PVP, Doug and his doctor were pleased with the results.
Any pain?
No.
Any burning, hurting? We just got you out of the operating room. You did very well. We will wait for him, usually within 45 minutes to an hour. He will be able to urinate on his own, and we'll have his wife come and hold his hand, talk to him, and within an hour he should be ready to go home.
Greenlight PVP delivers the ultimate enlarged prostate solution. This unique and simple treatment to an enlarged prostate combines the effectiveness of the surgical gold standard TURP with the safety and ease of a minimally invasive treatment. Free from urinary symptoms, free from compromise, freedom to go.
Wives are suffering in that their sleep is broken right along with their husbands. When that man is up and down out of bed every hour and a half, every 2 hours during the night, their sleep is disrupted.
We got home and he felt like normal almost, you know. He took it easy, had to take it easy, and he felt so good that he really didn't want to take it easy. He wanted to do more things.
Most of the patients who are having the procedure done go home soon after the procedure. They are very happy to have had the procedure and be home within a few hours.
The Greenlight PVP laser procedure has been proven safe, effective, and durable.
To me, it's great. It beats, you know, the old conventional surgery, and can't beat it. I was here at 8:30. I was home at 20 after 11. Walked out of here, and that was it. You know.
It's so much easier on the person that's having it done, and the care of a person when it's over. I mean, it's like a piece of cake.
With Greenlight PVP laser procedure, you'll experience freedom from suffering from an enlarged prostate in a safe, fast, proven outpatient procedure.
It's great. I think it's something that should have been here years before to eliminate the problems.
It was so quick, and afterwards, like I say, it was so satisfying that I would recommend it to anyone.
The patients are happy that there's a fix out there, and it's something that they're not going to be laid up in the house for 6 to 8 weeks with, that they're not going to be able to go out and play golf for 6 to 8 weeks. They want it fixed, and they want it fixed yesterday. The results are immediate.
To determine if you have the green light for PVP treatment of your enlarged prostate, talk with your doctor or call the number on your screen.
As men get older, many will develop some enlargement of the prostate. Over half of all men will have signs of enlarged prostate by age 50, and by the time men reach the age of 85, 90% will have signs of the condition. These signs include a weak urinary stream, waking at night to urinate, difficulty starting urination, and frequent urination. An enlarged prostate is not cancer and is not life-threatening, but it can affect your quality of life by robbing you of sleep and intimacy. Over time, an untreated enlarged prostate can restrict urinary flow and lead to urinary tract problems. If an enlarged prostate is treated in its earlier stages, there is a lower risk of developing complications such as urinary tract infections and bladder or kidney damage. The great news is there are several treatment options for enlarged prostate. Many doctors will prescribe drug therapy as the first step in treating enlarged prostate. While drugs can be effective, some patients find the side effects such as dizziness, nasal congestion, and sexual side effects to be unpleasant. Some men may even reach a plateau with drug therapy. That means they have to increase the drug dosage to be effective. But now there is another alternative. thermatrx Office Thermotherapy. thermatrx is a safe and effective alternative to drug therapy for treating enlarged prostate. thermatrx is a one-time procedure performed right in your urologist's office. It has helped thousands of men improve their quality of life without drugs or surgery.
I'm in sales, so I would be out during the day and I would always be looking for a place to have to go to the washroom. And if I would travel a distance, I would have to stop and go to the washroom several times, plus getting up during the night 2 to 3 times was just not good at all.
Having BPH is, you know right away that you have a problem because it gets to the point where you can't urinate at all, and it really does cause some very uncomfortable moments.
Enlarged prostate, also known as benign prostatic hyperplasia, or BPH, is a very common condition in men. As a man ages, his prostate enlarges. As the prostate enlarges, it encroaches upon the urethra, causing partial and sometimes nearly complete obstruction of urine flow. This condition is known as enlarged prostate, or BPH.
We've been performing thermatrx thermotherapy for over 3 years, and we've been very happy with the results. The vast majority of our patients have had a significant reduction in their urinary symptoms. They've been able to come off the medications that they were taking, and up to this point, all have been very happy with the therapy.
This is a great alternative for a lot of our patients. They don't have the side effects or the cost of the medications, and they don't have to go into the hospital to have a surgery. They can come into the office where they feel very comfortable. They know their doctor's there. They're going to be awake through the whole procedure. They're going to know the nurse that's doing the procedure for them and feel very comfortable in the surroundings they're in.
The day of the procedure, most gentlemen will take a few medications at home. All men will take an antibiotic pill, and many of the men will take a sedative, usually about an hour before they arrive in the office.
Prior to the treatment, they gave me a pill to relax me, which was fine, but I was wide awake during the entire procedure, listening to some music, talking to Dr. Nizzarello, and just carrying on a regular conversation. It was not a problem at all. It was an easy experience to go through.
After applying a local anesthetic, the urologist will pass a small flexible catheter through the urethra to the bladder, where a small balloon will be inflated to hold the catheter in place. A patented microwave antenna in the catheter then delivers heat to the prostate, causing changes in the prostate tissue that alleviates enlarged prostate symptoms. Once the treatment is complete, the doctor will deflate the balloon and remove the catheter. Patients are able to leave the office after the treatment and resume normal activities within 1 to 2 days.
Usually within a month of the therapy, they're noticing a remarkable increase in their urinary flow and are much happier with their symptoms.
But within a week, I had noticed that the first thing I noticed is I didn't get up as many times during the night. And then when I was working, I noticed I didn't have to stop and go to the washroom at all, which was great. And then about a week later, we made a trip down to Indianapolis to visit our daughter, which is about a 4-hour drive. Normally, I would stop 4 or 5 times. I didn't have to stop at all. My wife actually had to stop, and I didn't. It was great.
I have been following my patients for about the last 4 years, and I still keep in contact with them. They said that they're still doing wonderfully. They're not having problems. They're not getting up as much at night. Their flow is a lot better. They have a stronger stream. All of the things that we wanted to happen with this treatment did.
I can go 5, 6, 7 hours, 8 hours, and then when I go to sleep, I'm not waking up every hour, 2 hours to go.
I would recommend it to anybody. I really went through the procedure. I don't know what other procedures are like, so I can't say that much about it. From what I've read, some of the other procedures may take a lot of time with a lot of complications in the background trying to overcome the procedure itself. This one took almost no problem at all, and I would say that the case had been fairly serious before we started with this, and it has come along very, very well. I'm very happy with the procedure.
thermatrx has helped thousands of men safely restore their quality of life without the unpleasant side effects of drugs or surgery. thermatrx is not surgery and does not require a visit to the hospital. thermatrx allows patients to return home right after the procedure and resume normal activities within 1 or 2 days. It is covered by Medicare and most private insurers. thermatrx showed no decrease in sexual function in clinical trials. It is not a drug, so there is no danger of interaction with other medications. And thermatrx has a high level of patient satisfaction. A new day can dawn for you with thermatrx. It may be the last prescription you'll need for your enlarged prostate.